The main project we're currently dealing with within the Health Services and Policy Research Group is one which aims to put patients' own reports about their health at the center of the provision of primary care, so that when a patient goes to see their GP, they know that the GP will have information which has been collected routinely about how they are doing in relation to their conditions, and that these assessments are based on information provided by the patients themselves. This type of information is called patient-reported outcomes, PROMS. What we want to make sure is that when we say that the health service is delivering, this information is based on reports by the patients themselves, who know better whether they are indeed improving or not. The main problem is that clinicians feel very comfortable collecting information on measures that they have been trained to use, such as blood pressure, such as a blood test or an MRI scan. They are less familiar with other type of measures that focus on how the patients feel. One example of the mismatch between what clinicians and patients think about what the main problem of patients are in relation to their health is arthritis. The first questionnaires were developed with a focus on pain, because clinicians genuinely thought that was the main problem for the patients. But in the process of developing newer, better questionnaires that engage patients early on, we discovered that actually the main problem is stiffness for patients. Unless we had incorporated the patient perspective, we might well have oriented all our efforts to something that is of course very relevant, but not what patients thought was causing them, was having the biggest impact on their health. We're recognizing that clinicians need to be involved, but patients are absolutely key. Patients are the ultimate target here. If we don't engage patients in reporting, in trusting that this method will help them improve their health, we will not succeed. So, of course, we want to get clinicians on board to make sure that everything runs smoothly. They know best what are the processes, what are the intricacies of delivering care. But it's absolutely key that when we approach a patient with these measures, that they recognize it as a true opportunity of informing their physicians of their own health.